All right, so Because.Teeth podcast back with another episode. What episode we on, Cody?
Episode R today.
Episode R, and we have a special guest with us, the one and only Miss Brush with Britt. And I just wanted to say thank you for coming on. And
thank you so much for having me. I'm excited to be here and talk to you guys, meet you guys, see what's going on in Florida, right?
Yes.
Florida.
yeah,
Yes.
and actually,
So-
I'm glad you said that because it's storming so bad over here right now. So for any of our listeners, anybody watching, if you hear any like kind of commotion, it's probably just lightning or anything like that. So it's storming pretty bad over here.
Yeah, we don't have the
Yeah, and
perfect
it's-
California weather.
yeah, super sunny over here in San Diego, you know. It's a good life over here.
Yeah.
No
And we-
storms as of right now.
And we see it's still light there, kind of in a way, because over here
Yeah.
it is super, super dark.
Yep.
Yeah, at 7 o'clock, the sun's just going down because the time change. So it's super nice.
Gotcha. Well, it's like 10 o'clock over here.
Yeah.
So
On a normal day, I'd be in bed by now.
yeah, this is way past Cody's bedtime.
Yeah, 10 o'clock's past mine too.
Well, thank you for coming on. Our topic for today was actually recommended from one of our listeners. So we want to give her a quick shout out before we go into the topic. So thank you, Kaylee, for recommending this topic. And you can follow her on Instagram. Her Instagram is Tooth Fairy in Training, Kaylee. And her basically recommendation for, a topic was talk about like the pressures within the dental field, obviously she's a student, you can tell by her Instagram name, but we're students too. So, we kind of talk about like the pressure side of being like in clinic, but we also wanted to hear from you, Britt, like kind of the pressures outside, like, being like, I always say like in the real world, in an actual practice. And, I guess there's so many different kind of pressures that you can go into. Like talk about because, there's so many different things to think about. And I would say like really the pressures kind of correlate with like anxiety. Like, you feel that pressure. So you get anxiety, you get worked up and, just like our first day in clinic, like you talk about like that pressure. I mean, our first competency talking about like, doing our first scaling or probing. I guess probing would be the first one.
Yeah. And I'm sure she feels it. How did you feel going into an office right out of school?
Well, I mean, as far as like the probing competency, explorer competency, my first one was an absolute, I would probably call it a disaster. I failed at I didn't fail, but I got close to failing. I got a 75 on my explorer and my probing competencies. So that was pretty challenging. And then from that one, I mean, you just don't get tests like that. You don't have a teacher over you, like breathing down your neck, watching you turn this little instrument. So it's so stressful. But you get used to the competencies, which is kind of nice. Like by the end, you're like, okay, I got this. And then once you get into private practice, you don't have anybody really watching over you. I mean, there are some dentists that will go through and check, but I haven't had that experience yet. So that's been pretty nice on that part, I'd say.
Yeah. Well, that was actually going to be one of my questions because, like having, I mean, not just probing, but really like calculus removal, like anything, like, when you're a new grad, like do doctors really like kind of, go over you? I mean, I feel like there's going to be obviously those certain patients or there's certain things that you might not feel confident that you would want, the doctor to check. But like, did you ever, kind of experience kind of a weird, kind of thing with that, I guess?
I have been very blessed in the office that I work at, and I have worked for really good doctors. So thankfully, I haven't experienced that yet in my career. I do know some hygienists that have, though. And I would think if a doctor were to check me afterwards, I would just prefer them to tell me when the patient is not around rather than in front of the patient. Because
Yeah.
I just feel like that's kind of...
Yeah, you don't want to be put on the spot.
Exactly. You don't want to be put on the spot. And I think it's a good learning opportunity if the doctor did want to teach you something or just mention something to you. So, thankfully I haven't had that happen, but, there's times where I know that I miss calculus. And I think that that's another thing that we have to be okay with admitting. We're not perfect.
Yeah.
I mean, we see at least, 8 patients a day. And so it's like, you're not going to get every single calculus piece all day long, every day. So when I do have difficult patients where there's calculus that I can't remove, I tell them, there's an area here where the calculus is super tenacious. I'm going to put a note here in the chart, and we're going to check it again next time. And
Yeah.
if we can't do anything about it, then that's when we refer out to perio. Like, it's okay to tell the patient that there's a difficult area. I mean, you don't want to just not tell them and then not put a note about that spot and
Yeah.
never go back and check it. So, yeah, I think it's important to be able to admit that, we're not always going to have that perfect cleaning like we do in school.
Yeah.
Because in school, it's like they find one piece of residual and then you go back and scale it for 30 minutes. Like, you don't have that time. You do not have that time in private practice or corporate.
All right. Well, that's good to hear, because I mean, I know I've even had patients. I mean, even with our 4-hour windows, there's been times that, I've had some really, really tenacious, and I'm just like, all right, listen, we're going to move on to a different quadrant. And then when you come back, after maybe that, tissue kind of settles a little bit, I got some of it, but I didn't get it all. So that's good to hear that, because, I've done that even in school, like, go back on a certain quadrant, or, so I like that you kind of, make me feel a little bit better about that, because,
Yeah.
It's one of those things you feel like kind of defeated sometimes, at least, in school, when it's like new, so.
Yeah. And, another thing too is that, like, sometimes you just have a day where you can't get your angulation right. Like, I've had it to where, I have a patient where I just like remember the day and I'm like, oh my gosh, I could not get that piece off. And then they come back for like the other side, and then I check my residuals from the last appointment and I pop them right off.
Yeah.
And I'm like, wow, like, what was, I must have, just had a bad day or just not the right angulation or whatever it is. So sometimes it's just a matter of like trying it the next appointment and seeing what happens.
Yeah. Yeah, exactly.
Yeah.
And that's one of those things, like I said, it could be just the instrument. Maybe that day you used the wrong instrument, and then you had the right one that time, or, there's so many different factors that, I just like, from the patient standpoint, it kind of, I would say I would feel a little bit, I guess, a little bit awkward at first, just like, oh, like, I came here to getting cleaning, but you didn't really get this part off or something, so I guess that's when you kind of get in your own head, I guess you would say, right?
Yeah, it's easy to do.
Yeah. I mean, like, I feel like if you explain it to the patient, well, like, this calculus has been sitting there, it can sometimes get cement hard and attach the tooth. Like, sometimes there's just that struggle of not being able to get it off. Like, sometimes you just can't get it off.
Yeah.
And, like at my office, we have typodonts that have like calculus on it to show them. And I think, you show them what it looks like and just how hard it can really get. I mean, it's pretty insane how some calculus can be so tenacious.
Well, I like how you said about like, showing them, because I'm like real big on like, visuals and like photography and, all of that stuff. And, that's one thing I haven't really gotten, super, I guess, comfortable with. But like, I really want to like incorporate like the whole photography thing, like, in practice and stuff. Like, I know we don't have like a lot of time to sit there and take a bunch of pictures, but, some of those cases, like, say, hey, here's a before, this is where we're at, and this is what it's looking like, so that way they kind of understand. Because I think when you explain that to patients and really give them that visual, then it kind of like validates for them,
Yeah, and I've seen it. I mean, I love that point, because I think that photos and x-rays and typodonts and all of that stuff are really useful for the patient. And, if you have a patient that has a lot of stain, like for instance, on like the lower lingual, oh, you have a lot of stain right here. Oh, it's because my teeth aren't aligned right there. So it's really hard to get in that area. Well, you also have it on the top teeth, and those teeth are, perfectly straight. So it's a matter of showing them how to brush correctly or get those spots, but
Yeah.
if they only think it's right there in that one spot where their tooth isn't aligned, then they just think, oh, it is what it is. Like, I can't do anything about it. But whereas if you show them the photo of the top and the bottom, it's like, okay, it's not just because that tooth isn't aligned. It's because we're missing it when we're brushing.
Well, I guess also too, like with like when we talk about like the pressures, like there's so many different, ways to correlate it, but like also too, like, I guess talk about like your first day at work, because like, I know like we're kind of getting, we're not there yet, but I would say like, we're going to have that, like when, like I say, like anxiety, like, not so much like we're going to feel pressured, but you get that you want to like make, the doctor proud or make yourself proud that you're doing this, so how do you, I guess, manage that, or how do you, cause like, I used to always kind of like have like a code word in my head, like, okay, like this is my code word, get myself out of like thinking like,
That's
like
weird.
too much in my head. Like, how would you, you're laughing at my
I
code
don't really
word?
know what you're talking about.
I don't know, just like you feel like like when you're in a certain situation, like going into like maybe not having all the instruments, or you're like, okay, I got to step out. Like, I feel like this looks bad. Like, you get in your head, like, how does one cope with that? Like, everyone has their own, like, I guess, different thing. I mean, obviously I think that in a nutshell, you would just say like, keep on keeping on, but I mean, some people like, they get very overwhelmed or very pressured, and can you potentially like walk out or something like that, you know? I would never do that, but I'm just saying like, there's certain people that, go through that.
Yeah, I think with like your first day at work, it's really important to remember that it's not going to be like school. You're not going to have enough time to sit there and explore every single tooth. Like, that's just facts.
Yeah.
Like, you just do not have the time. And things are just going to have to be a lot quicker. If it's your first day, maybe don't talk so much. It might be a little quiet for the patient, but that's okay. Like, do what you have to do, get through the day, know that even though there might be limited conversation, at least you're doing as much as you can. And I think it's always good to ask the doctor, like, what do they expect of you? And know, like, ask if you can come in maybe on your first day. I would ask if I could come in 20 minutes early, or maybe you do a day of shadowing before your first day. So that way you can see like what the office is like.
Yeah.
But being able to like see your schedule ahead of time is really helpful. Being able to look through all the medical history, see who needs x-rays, who needs probing. Maybe somebody is going to be willing to help you. Hopefully, flipping the room would be super helpful.
Yeah.
So if you have support within the office, it's really nice. They know you're a new hygienist, so hopefully they're not expecting you to be super, super quick. And maybe even giving you the easier patients. If there's 2 hygienists there, maybe they let you have the ones that don't have x-rays that day. That way it's just a little bit easier for you to like get in the groove of things.
Yeah.
But overall, you just have to, like everybody says, fake it till you make it. But it's kind of true. Like, your first day, the patients don't know you're new. And even if they ask, how long have you been doing this? Well, you've been cleaning for 2 years, maybe, depending on your program. You know how to clean teeth. Like, that part. It's just having a shorter appointment and doing it in a much faster way.
Yeah. I like those tips that you said, those kind of ways that you can kind of not really shorten the appointment, but like areas where you can kind of cut corners, like you said, with, like just
not
like flipping not talking as much. That's a good thing to do. Like you said, at first, focus on what you need to do before you try and get like fancy with it and kind of incorporate other things that aren't always the most necessary. Or like you said, if you can have someone help you flip the room and just make it go a little quicker, so then you can focus on what you actually need to be doing.
Yeah, or like even having somebody help you with probing too. I mean, if you're doing probing by yourself, it takes up a lot of time because you got to go back and forth and all that stuff. So it helps.
So our next kind of idea that we wanted to touch on was x-rays. So how were you with x-rays coming out of school and transitioning over in an office? Did you have any that you struggled with? Like, how did that go? And then I guess with your doctors as well, how did they take your x-rays? Were you taking perfect ones every time or what?
Well, so fortunately for me, I had 5 years of assisting experience before I started hygiene school. So x-rays, I mean, I'm pretty, not to, not to toot my own
and
horn,
Greg,
but
you guys,
like I already knew how to take x-rays, thankfully. And at my office, we do like panos and then like bite wings and PAs. So we're not having to do a full FMX, which is nice. But so I didn't have that struggle, thankfully. But I think that the doctors, again, they know that you're new. So hopefully they give you, good advice and they're not too critical on you, but they give you what you need to hear so that you can get better.
Yeah. Because, I mean, like with the x-ray things, it's just practice. Practice is going to make perfect with that.
Yeah, it is. It's a whole lot of practice. And I mean, that many years, I can tell you. So 5 years of assisting experience taking x-rays, and I still got a B in radiology in hygiene school. So
yeah, it's one of because they're looking at every single detail, which you know it kind of comes back to, you know, like there's certain things that you don't really need this because you get it in one shot, but that doesn't make that shot less better or you know what I mean? Like there's different ways to kind of look at it, like from a school standpoint or getting graded standpoint.
Yeah, and you can't get better unless you practice. So like avoiding the x-rays is not a good thing. I always, you know, encourage people to just, you got to dive in and push yourself to just keep doing it.
Yeah.
Otherwise you lose the skill.
Yeah, for sure.
Yeah.
And well, I know you, so how long have you actually been practicing like outside of school? Like when did you graduate, I guess?
So I graduated 2020 and I've been practicing hygiene a year and 5 months.
Okay. And you've been at
So
the same...
not very long. I still consider myself baby hygienist.
So have you been at the same office the whole time?
I have. So
Okay.
I've stayed at the same office, but when I started, I was only working there 3 days, so I was like temping the other
Gotcha.
days. So I have worked at some other offices here and there.
Gotcha. So that's good. So I'm assuming the tempting kind of turned into like kind of securing the spot, because we hear that a lot about like, you know, maybe starting off, you know, part-time and then, you know, kind of finding your fit into an office as well is kind of part of that.
Yeah, I think that temping is definitely for specific hygienists. Like it's not for somebody like me. I like a routine. I like to be in the same operatory. I like to know where everything's at. And going to a different office every day is so stressful for me. So I did it for a little bit, but overall, I think it also gives you a good idea of what's out there too. There's so many different types of offices out there, so many different types of doctors, hygienists, coworkers, equipment. So it does give you a good like base knowledge of what's out there and what to look for, and hopefully give you an idea of what you want.
Yeah. That's just good experience. It's, you know, I
Yeah.
mean, it's good experience, which sometimes the bad experience is a good experience, you know?
Yeah. Yeah, exactly. And I mean, you'll find, you know, some offices will have you do like 45-minute appointments or an hour appointments, things like that too. And you have to find what works best for you.
Yeah. Well, so obviously this is a private practice you're working in, because I know you mentioned that, but did you work in any corporate offices or corporate
So I haven't worked in a corporate office. I did as an assistant for a little bit,
Okay.
but my office is a very large private practice. So 11 operatories, 6 hygienists a day. Um, so it's very big, but it's not considered corporate because it's privately owned.
Gotcha.
As far as like working corporate, I know that some hygienists, you know, they do it right off the bat, and you have like 5 days you're working full time. It depends on if that's for you, you know.
Yeah.
Like for me, working 5 days is tough, especially as a new hygienist, and even as an experienced hygienist. Like working 5 days is hard on your mental and it's hard on your physical.
Yeah. You know, I wanted to kind of ask you, like, I'm pretty sure you're like in a general office, if I'm not mistaken.
Yeah.
Okay.
Mm-hmm.
And do you like that, or did you kind of like choose that? Like, did you, like, what kind of brought you to that, I guess?
Yeah, I do like general because I feel like I get a variety of, you know, prophy, child patients, perio patients. You know, I like that. And I did work in a perio office. I temped there for a little bit, and I was so surprised that it was not that much different.
Yeah.
Like that was like a shocker to me, because in school, I mean, you hear like, oh, referral to perio, like, and I'm thinking like, what do these hygienists do over in perio that's so different from general, you know? I'm like,
Yeah.
what's going on over there? But you know, it's really like the doctors doing surgeries and things like that, but the hygienist is still doing the same thing, same instruments, like it's not that much different. And so I'm like, oh, okay. So you know, with perio, I love doing SRPs. I do, but I know that long term, that's
Yeah.
not something that like my hands and my wrists could handle. As much as I love it, like sometimes it, you know, your wrists are just aching. So that's what would ultimately probably keep me away from that if it was like a ton of like SRPs and things. But
Yeah.
I do love SRPs. I do.
Well, I guess how many would you say that you do like in a general office? I'm sure you do them every once in a while, or
Yeah. Probably, I mean, like this week, I think I did like 3. It varies. I mean, sometimes I'll go a whole week and not do any, it's
Gotcha.
just perio maintenance and prophies.
Yeah.
But I mean, I would at least have 1 a week, I would say.
Gotcha.
But usually more though.
Well,
yeah.
I because Cody is, I've talked to him about perio, and when we first started the podcast, he's like, no, like I'm not team perio right now, and it's because like you said, like in school, like it's portrayed as like I guess it's not that it's like so much harder or anything, like you said. I mean, we're all trained the same way. We all come from the same school, so it's not like there's a perio hygienist school or training, per se. It's more you just kind of learn on the fly, like more like recognizing different things, or learning specifics of that office or kind of thing. So I'm hoping that this is kind of reiterating to Cody, like, the perio is kind of easing him in a little bit, so.
Yeah. And sometimes perio offices, like the perio patients fully understand their periodontal disease.
Yeah.
So sometimes their hygiene like is better than in a general practice because they know if they don't keep up with it, they're going to lose their teeth.
Yeah.
So sometimes, you're doing these perio maintenance appointments and they're so light.
Really?
It's like hardly anything. Mm-hmm.
That's interesting. That's cool to
Yeah,
hear.
but I think she's definitely right though. The instructors, just in school in general, you kind of do get that picture painted like a perio office is just like I know exactly what you were saying, and I felt the same way. That's kind of how I had a perio office pictured in my head.
Yeah, and you do see, some like extra, I guess you'd say like gnarly stuff, maybe some really a lot of mobility or recession or attrition, teeth like really grinded down, things like that. But I mean, it's not a whole lot different.
Yeah. Well, I'm excited. I'm excited for the perio. I love perio. I don't know. I said this from I think our first episode, like, it's just, like you said, like also too, like even with the corporate thing, you're going to find your lane of what you like or what you want to kind of go into. And like for me, the perio, like really, I really liked it. Like, I know assisting when I first, got into assisting in a perio office, it took a long time for me to really kind of get confident because I was newly, an assistant. That was my first office, was a perio office. And I knew it was going to be challenging, but the goal was always to go to hygiene. I knew it would benefit me for hygiene, like really understanding all of that stuff. So that's really why I kind of like pushed through it, because it took me months. I mean, months at an hand, everyone's, different learning curve and stuff. I'm a little bit of a slower learner. But, I really knew that the perio was going to benefit me for hygiene. So I kind of just stuck with it and perio, I'm team perio till, I mean, I'm not going to say that I won't ever like work at a, general office or anything like that. But, I'm just saying like, I that really intrigues me and I like that part of dentistry.
Yeah. And there's some people that like, pedo too.
Yes.
I just spoke with a hygienist yesterday and she works in pedo and she loves it. She said like it's just her favorite. She's not hurting her hands trying to remove much calculus. It's
true.
little, very little calculus. You will get some teenage patients, but hopefully they're not too advanced. But she said she loves it.
Well, we got to actually like circulate in a like a pedo office during our program, and I kind of had this mindset coming from perio. Like I knew like we didn't see many kids in perio, obviously, like not all the time, every once in a while, of course, but I just kind of I kind of thought that I would not like pedo really as a whole. And when we got to circulate in this office, I have to tell you, like, it really changed my mind. Like, I really liked working with the kids, talking with the kids. Like, they're so entertaining and so, like, fun. And, it really changed me. I was like, I never saw myself, like, maybe even considering a pedo office. But after that experience, I really liked it. And it changed my whole perception, I guess, of that. So.
Yeah, seeing kids is super fun. I love it. The whole show, tell, do, that is it right there. I swear. If you remember that and whatever toy kid is holding, pretend it has teeth and pretend to floss it and brush it. Like that is like golden ticket right there.
Yeah, key. I like that. You gave us a secret right there. We like that because
I learned it from my doctor.
Really?
Yeah.
Yeah, because it's hard sometimes. We went to a volunteer thing over last weekend, and we volunteered over in the pediatric side, and we had a kid come in that was their first time ever at a dentist in a very big setting like that, and we really couldn't do anything. We kind of had to dismiss her, and I just kind of talked with mom and said, hey, this is her first time. It's okay. We're gonna ease her into it. That's kind of honestly the goal with the first appointment, regardless. She just was not having anything close to her mouth. She wanted to be in mom's lap. We were patient. We tried to like let her calm down and talk with her, and she was very good with me for the most part. But it takes a special person to work with pediatrics.
Yeah, and we tried to get her attention. She was wearing like some little like dog shoes. We started talking to her about dogs and stuff, and tried it. We tried everything.
We really did. We
like
put our best
I
effort.
turned everything into a toy. Like the saliva ejector, I just call it a vacuum and I say it's going to make a noise just like a vacuum because sometimes that will scare them. The air and water syringe is Mr. Elephant. He blows air and water, like everything. And then I let them squirt the little water syringe across the room. Like I just turn everything into a toy. And like even giving them a mirror too so that they can see helps too, just letting them hold it so they could see what you're doing. So just some tips.
No, we appreciate it.
I had a kid who kept, after I showed him the air water, he kept squirting his mom the whole appointment. I'd be like over doing something, he would pick it up and squirting his mom. His mom's like, stop doing that.
But it's because they have fun. You have to make it fun for them. It's part of giving them that whole experience. It's not so much just go there and clean. It's giving them that whole feel comfortable thing.
Yep, I love it.
Yeah, well, we appreciate those tips because I'm going to use them.
Yeah.
I mean,
I love it.
I don't know how many kids I'll probably see, at least at first, but you never know. I say that's one thing I've learned in dentistry is like, things you're always learning. There's things that are always fun. You're always going to have different, cases, different, things. There's so many, it's almost endless, which I really like,
Yeah, it is endless. And that's something that I even am excited about now, learning about new stuff. I love it. I'm like, yes, I will never know it all.
Yes. So did you go to school in California? I'm assuming, obviously, because you got licensed there. Okay, because a lot of people are going to different states now because the whole mannequin exam thing. So I didn't know if that was maybe you were one of those or anything.
I went to school in California, and I took my I didn't take it on mannequin. I took it on a live patient.
Yeah, that's a lot of pressure right there. We're fortunate. We're still pending the actual final decision of mannequins in our state, but we are hoping that by the time we take we're like at the last step. So basically the governor has to sign it and then it's effective immediately. So
I hope you guys get it.
Yeah, I hope so too. We're hoping for that because that's a lot of pressure too. Like it's not just show up and clean a patient. It's you got to get the patient, you got to get them there, make sure they show up, make sure they qualify, and
it's too much.
And I know you have an episode specifically where you talked about it. I listened to that one, and you made a lot of good points about just like how people think that you might not be competent enough doing it on a mannequin now, and you made some really good points about how that's not the case and all the extra struggles that it does take with a patient. So I did enjoy that episode, and you made a lot of good points to what a mannequin does versus a patient.
Yeah, I mean, ultimately, like just going through the program shutting down during COVID and experiencing that, and then just having your career questioned over an exam, like if you can do it on a live patient or a mannequin. I mean, that was just like heartbreaking. And to even hear professors that like you've worked with over these past 2 years say that they think that you need to take it on a live patient, I was just like baffled, honestly. And so I think that gave me a whole new outlook on this exam. And then even with all like the social media stuff and just being able to talk to other hygienists in different countries, they don't even have the practical exam. You go
Wow.
through your,
I
you
didn't
go
know
through your,
that.
yeah,
That's
yeah.
interesting.
You go through your schooling, you maybe take a written, and you graduate and you get your license. It's like you proved yourself with all of your competencies throughout
Yeah.
those 2 years. You've shown what you can do. Your professors are the ones who know you best, and they know what you need to improve on and how to teach you. So by the time you're done with it, you should be good to go.
Yeah.
In my opinion.
Yeah, no, I agree. I can definitely. I mean, obviously, we want
Yeah.
we want that now, But
Yeah.
but yeah, I agree with that.
I do like the mannequin. I like that it makes it a more even playing field test.
Yeah.
As far as like it being on a live patient, there's just so many variables. It's not even across the board. Some patients are extremely different, maybe
Correct.
difficult to get numb. Maybe their calculus is super tenacious. It's just not a fair exam in my eyes.
Yeah. It's a whole different thing. It's a whole different ballgame.
Yeah.
Like, I think with, we're excited because we're hopefully going to be able to see the actual same kind of mannequins, I believe, that'll all be on the exam at our school. So we're really hoping that
Cool.
Gets put through, and we'll be able to kind of practice, I guess, on that, or at least see it, because I mean, even though that's easier, it would still nice to be kind of be prepared,
Yeah, because it's definitely different.
Yeah.
So.
Yeah. Yeah, I know. I never scaled off calculus on a mannequin, so I guess that would be another factor with that you're just not sure of. You don't know how it's going to go or how easy or hard it's going to be to remove it. So
Yeah.
it's another thing.
Yeah, and I keep hearing them keep making changes to these mannequins since they first come out.
Really?
Because I guess at first the teeth were like soap and they were just scraping off, and there was the whole thing, don't use sharp instruments because it's tearing it, and then the cavitrons are ripping the tissues. But they've made these changes to them, so it's like every year it's like growing and getting better, and
that's good.
They're making adjustments to make it more realistic and lifelike. So it's good that they are progressing.
Well, I know I looked them up because I believe one of our instructors told us what the brand was or where to find them, and those things were $400.
Yeah.
They're really expensive. So I'm hoping, whoever's buying them or whoever's doing them, they're for that price. It better be, pretty, well off, at least, for our sake too,
Yeah.
All right. Well, I have one more question for you. This is a little off topic, but I just wanted to ask you about the whole loops, because I'm kind of in the market for loops. Cody has loops, and I'm kind of in the market, so I'm considering the different brands. I wanted to ask kind of maybe what loops you have, kind of maybe your experience with the ones you've had, or maybe looked at, or that kind of thing, because I want to say you have loops. I'm pretty sure I've saw them on your Instagram before.
No, just kidding. Could you imagine?
I was like, wait, what?
Could you imagine I'm all practicing without loops? Heck no. So I have Q optic loops. Just at the time, that's just what all the students were buying. So we all kind of either got Q optics or Surgitel or Surgitech or Surgitel. I forget what the other one's
I've
called.
heard of that one. Yeah,
Surgitel. But now they have these ergonomic loops.
Yes. The little angulation on them.
Yes. So I think that is definitely worthwhile to look into those, especially while you're a student, because you're going to get the best discount.
Yes.
I have yet to practice with them. I've tried them one time for maybe 10 minutes, but I think that is going to be a game changer. As far as my Q optic loops, they do the job. My battery did go out within the however long it's been that I've had them, but they replaced it, no charge. And then just recently I had the wire go out, but when I got them, it came with 2 wires. So switched that out, no problem. But other than that, they've been fine. I think it's also good to look into the different magnifications. At the time, our teachers were just 2.5, just get 2.5. And I didn't even look into a 3. So I think that you should at least try it to see what you like. Because, even now I still don't know if that would be better for me or not, because I haven't tried it. But I think that those would be the options that I would look into are the ergonomic loops by Design for Visions. There's also Lumident. And then there's another one. I think it's called Andu Medical. medical loops or something like that.
I feel like I came across that one too. Yeah.
Yeah, I think that those are the three that I've seen with like the ergonomic type loops. But yeah, that would be my advice on that.
Okay, cool. I'm still shopping because we had, you know, a rep just like in your school that come out to our school, but it was only one and there were so many. And, you know, as you can see, I have these thick glasses, so I have to really kind of take like all things in consideration, and I wanted to make the right decision, you know, so.
Yeah, that's a really good point. So when I got my loops, I also had glasses, and one of the reasons why I got Q Optics was because it has the insert prescription.
Mm-hmm.
So if your vision changes, you can just buy a new prescription and switch it out. I think the prescription is like $100 within the one that goes into the loops.
Gotcha.
So that was another reason why I got Q Optics, because if you get the prescription built into the loops, then your vision has to stay
Yeah,
the
you're locked
same.
in.
You're locked in. So that's another thing to take into consideration. But I ended up getting LASIK. So I got to take out my prescription, and now I no longer have it, which is nice.
Yeah. That's interesting. I don't know if
Yeah.
I can do the LASIK. Did you like it? This is off of dental, but
Yeah, I loved it. I loved
Yeah.
it. It was a weird experience. It's a like whole nother story,
Yeah.
but I would do it again for
Okay.
sure.
Interesting. Because I that's one of the, I mean, honestly, like I've heard from, you know, other doctors and stuff, like after years of using loops, they have to get LASIK too, because it kind of distorts, you know, your vision.
Yeah. Yeah. So far, so good. I mean, it's been like 3 months
Okay.
since I've gotten it. So I love it.
So still new. So you'll definitely have
Still
a good,
new.
yeah, a good, well, at least going through it too. Cause I mean, I've never heard bad things or anything, but anyways, off of dental. But so our next thing, Britt, is we're going to go into our segment, and this is just basically our dental term segment to kind of quiz each other. So it's my segment. So we're going to go into that.
Yep. Dental terms 102.
So today's topic of the episode was pressure. So we tried to kind of, you know, correlate our dental term with the topic, and we are going to talk about blood pressure. So we're going to keep it a little.
This is perfect for her.
This is, you know.
Oh, come on. I'm
Yes.
like the
Well,
BP queen.
Yeah.
Well, that's what I was going to say, because I know I just reposted your tweet that you posted yesterday about blood pressure. So I was like, you know what? This is just meant to be.
And that's awesome, because we were talking about the dental term earlier. I didn't know what yours was, but I wrote down systolic and diastolic if we didn't have anything, because I wanted to ask her specifically.
So, I mean, I guess just, I mean, anything you guys
I'm
have
going to
about
sit
blood
back. I'm
pressure.
going to let her handle this one.
No. Let me hear you. I want to hear what you got to say.
So, I mean, just
about it. Come
anything
on.
about blood pressure, like, you know, just, I mean, obviously you can talk about the different classifications, like.
Yeah, well, we know there's the whole chart. I don't want to get into numbers right now. I need to review a little bit more.
All right. Well,
Systolic,
Britt,
diastolic. Like I said, I'm gonna let you handle this. I know the cutoffs, and that's
all right.
That's what I know.
Okay, so some of you may or may not, but I mean, I'm passionate about a lot of things, you know, medical history of you, blood pressure. I think blood pressure just hits home with me, just because in school I had quite a few patients, you know, you have to check their blood pressure, and they come in, and you don't want to dismiss them because you don't want to not have a patient in the chair, but you have to be ethical. You got to do the right thing, and you got to give them a medical clearance. And it happened to me multiple times where I did that, and thankfully the patient came back and they were either like diagnosed with hypertension, maybe lifestyle changes or medication, but they would ultimately, you know, tell me, thank you for checking. Like, I had no idea. And that always sat with me, because if you wanted to be that clinician that just, you know, wrote down some fake number and because you wanted to see your patient, I mean, unfortunately you could do that, but we're not supposed to be that way. So
yeah, definitely not. Couldn't even imagine somebody writing down like wrong numbers. That's terrible. That's why I like shake my head. I'm like, please,
yeah,
don't even.
So the way that I kind of explain it to a patient is hypertension or high blood pressure is known as the silent killer. So you could walk around with absolutely no symptoms and never know that you have it. And your blood pressure reading is basically how hard your heart is working to pump your blood throughout your body. So if you have no symptoms symptoms, and then you're walking around with high blood pressure, you know, your heart is just working so hard to get your blood throughout your body. And one day you could end up with a stroke or a heart attack. And we all know that dental offices can be really stressful for people. So if we have a patient with high blood pressure, then we go and stress them out. We could potentially raise their blood pressure. And,
Mm-hmm.
you know, it's very unlikely, but you could cause a stroke or a heart attack. And, you know, we use local anesthetics. So that has epinephrine in it.
Yep.
As we know, epinephrine raises the blood pressure. So again, another situation where you could potentially cause an incident in your dental chair. And, you know, that's one thing as a hygienist you never want to live with. You know, God forbid a patient die in your chair. But if that were to happen, at least you would know that you took all the precautions you were supposed to take. So
Yeah.
that's kind of my take on blood pressure.
All right, so you're.
I think that's good.
Well, we got to talk about like the numbers because that's gonna
Yes.
help us. So
Yeah,
I mean,
definitely.
I guess I'll let you, Britt, kind of talk about the numbers and stuff, and I guess what is, you know, pre. Well, I guess we're not allowed to say pre. I shouldn't say that.
120 over 80 is normal. Let's start there.
There you go. We'll start there.
Yeah, so your 120 over 80 is normal. I mean, in the dental practice, if you're, I don't, you know, to be honest with you, like I don't remember the exact numbers right off the top
Yeah.
of my head as like pre-hypertension, whatever all the numbers are. But like in our office, if it's like 160 over 100, that's an automatical medical clearance. And then if you're looking at numbers like 140 over 90, then you're going to be, you know, waiting 3 minutes, retaking it, maybe, waiting 5 minutes and then retaking it, and maybe do that 3 times until the number goes down. But our like main number is the one. Shoot, now I'm forgetting. 160 over 100.
Yeah, the cutoff. That's the same thing
Mhm,
that
the
it
cutoff.
is in our
That's
school
what we use in
too,
our
so.
clinic, yeah. And I know
And-
whatever the higher number is, whether it's systolic or diastolic, whichever is higher on the chart, that's the one that they get classified as.
Yes.
Is
Case
exactly,
question.
yeah. And I always start to talk to the patients, even like, let's say I have a patient and every time I see them, it's like creeping up. I'm talking to them like about it as soon as I see it going up. And I let them know, you know, if it gets to this point, then we're going to have to eventually give you a medical clearance. That way they're aware of it before it happens. So that way, if they do come in one day and it is, you know, that higher number, they're not shocked by the fact that we give them a medical clearance.
Yeah. Well, I had to look at my phone to make sure I knew what the number is before I said it. But all right, so there's also like a medical emergency blood pressure. You know, there's an urgency and there's the emergency.
Where you would send them to like the ER.
Correct.
Yeah.
So
I actually don't
What's that,
even remember the number.
180?
yes.
180.
Yes.
Yeah, the only reason I'm familiar with that, my dad, his always runs high, but he's like, oh, it's just normally high. But I was like, dude, it can't be running at 150. This isn't a normal thing. Like, he takes medication for it. It just runs high, I guess. But like I said, he probably needs to get it checked out and maybe his dose changed. And
Yeah, and that's one of those things too. Like I've even had patients that I've had to, you know, dismiss in school specifically too, just because, you know, they're on medication, but it's still high and needs to be reevaluated. So every couple of years it needs to, you know, just make sure that they're doctors, because they're going to, you know, if they don't have anything like you said, Britt, about being a silent killer, you're not going to notice a difference sometimes.
You may not feel it. I think another thing too that I hear a lot is hygienists say, oh yeah, I take it when I do SRPs or scaling and root planing.
Gotcha.
And I just think there's an issue with that, because you may have a patient that has high blood pressure, but they never need scaling and root planing, or maybe they never need restorative work. So when are you going to check their blood pressure at that point, you know?
Yeah. Well, that really just ties into comprehensive care as a whole. You know, it's not just so much, you know, coming to, you know, see us and, you know, clean. And that's, you know, one thing that, you know, we like to, you know, advocate on too, is like, you know, there's so many different ways to be a hygienist other than just cleaning teeth, you know, and that's one of those things, you know. So like you said, it's important for you, but, you know, we're definitely taught that, you know, in school, and make sure that it is, you know, something that you really address with the patients, because they are appreciative. You can save lives. It's truly, you know, one of those things that it can be serious.
And it's hard too, because a lot of offices don't practice it. So when you're a new hygienist and you go into an office, unfortunately, it's going to be one of the things that a lot of new grads are going to see. You're going to go to an office and nobody's checking blood pressure. And, you know, it's up to you to change that. And you can't be, you can't be afraid to speak up, because at the end of the day, it's your license at risk.
Yeah, definitely. And it only takes a couple minutes. You know, we have all this technology. I mean, you know, the wrist ones, I would definitely say that there's some brands that aren't the best, you know, but, you know, but even the arm ones, you know, the doctor's got to have something in the office regardless in case of, you know, an emergency.
And it's better than doing nothing. I mean, even if it's not the most accurate, hey, at least you have a ballpark range of where you're working.
Yeah. And I've had it too, where I worked at an office, and the office manager used to be a hygienist. She was actually like really happy to hear me talk to her about why the office should be checking it. You know, she liked that. Yeah. I mean, I got a job offer from that office, I feel like, because I had that whole conversation with her. And she's like, okay, like, you know, she's not afraid to bring this up, and she just got done with school, and all this stuff is like fresh and ready to go, you know? So, you know, you can't be afraid to speak up.
Yeah, definitely. I like how you say that, because it's one of those things too, is like, you know, getting into an office, you know, or you know, anybody, not even just hygienists. I mean, a new dentist, a new dental assistant, like you can, you know, kind of easily fall, you know, into, you know, that offices or that, you know, companies, you know, beliefs or, you know, practices that you really got to kind of do what's right for the patient, most importantly, first and foremost, you know, and that's definitely one of those things.
Yeah. I think too, another thing to touch on is infection control too. You know, I've worked at offices where you just see something and you just know it's not right.
Yeah.
You can't just let it fly. Like you got to speak up. And I've had to do that myself too. So it's going to happen, but you got to treat everybody else the way you would want to be treated. And if you don't want something, if you don't want something in your mouth, then don't go around, you know, doing the same thing to your patients. It's not
exactly
right.
And you catch yourself. I mean, even learning, you know, one of those things, like when you're learning, like maybe you don't, you know, initially know what's right or wrong because you're learning, right? But, you know, after you kind of get in the swing of things, you know, it's one of those things like you talk about, you know, not speaking up, and it's not always directed at the doctor or the office. You know, sometimes it's just other individuals, you know, thing, and just say, hey, you know, maybe they just never got taught that or they didn't know that. So it's okay to like have that conversation with them. Like, hey, like, I know you're doing this, but, you know, I'd really, you know, can we talk about it? You know, I think if you approach anything like that, like, I think there's a conversation worth having, you know?
Yeah, I have an example of, you know, when I was an assistant, I had a doctor say, oh, I'm going to show you how to pack cord for a crown. And in California, assistants cannot do that.
Oh, really?
We're
Gotcha.
at least when I was an assistant. I don't know about anymore. I don't know about now. But that was one of those things, you know, I was brand new, you know, doctors asking me to do it. Like, the doctor is showing me as if I'm allowed to do it, like I must be allowed to do it. But that's not always the case. So you got to know like what your scope of practice is and what you're legally allowed to do.
Yeah. And you learn that too. Like, I mean, obviously, you know, you learn the legal part in school, so you should know. If you didn't know that, then you need to research that and you know, before you say yes, you know.
Yeah, we're in the thick of that right now. We got a paper coming up. Hopefully you're working on it.
I started it.
Dental Practice Act.
I'll say I looked at it. I wouldn't say I started it per se. I looked at it. But yes, that is a big part of it, because there's a lot of things. There's so many different things like that, like correlated with that.
Yeah,
so.
And she's right. It's your license. It's up to you to make sure you're following and doing what you're supposed to.
Yeah.
Yeah.
All right, Britt. Well, we will wrap up this episode. We appreciate you coming on, but before we sign off, we want to do a couple of things. So anybody watching, we are going to offer you basically a discount on any of our merch on our website. Mm-hmm. So if you haven't been on our website, we sell some cool, you know, different, you know, basically dental apparel, and, you know, we have stickers, we have shirts, we have hoodies, and sweaters. And if you haven't checked it out, go check us out. We have some of it behind us. So anybody watching the episode, if you just go type in the cart, you'll have a promo code.
And what's the code going to be?
You tell them.
No, put it.
Oh, we're gonna put it up here. He's gonna make me pop tag it. So we'll pop tag it up there, and just input that, and you'll get 10% off of everything on our website. So
I love it.
we appreciate that. We appreciate you coming on, Britt. And I guess the last part, to make it fun, we're gonna let you go shopping a little bit, because we want to kind of send a token of thank you for coming on the episode and send you something. So really, you get to pick some stuff. So we're not gonna give you the whole apparel line, but we'll send you one item, and we'll whatever you like, we'll kind of showcase that stuff, and you tell us, you can tell us after, like what size and where to send everything and everything like that. So I'm going to pull some of the stuff out. So Cody, you're going to have to talk, because I'm not going to be able to hear her.
All right.
So I'm going to pull it out. And so when she gives me the thumbs up, or say yes, let me know.
Okay.
All right.
All right. Here goes Greg. Greg's going to model it for us.
No,
here.
I'm not modeling it, but you can at least show it. Yeah, explain it, I guess.
All right.
So, our first one, obviously, is
What are we
going
starting
to be
with? The
our
staple
sweater.
here.
So this is kind of like our staple logo, I guess you can say.
Okay.
So that's a great one.
I like
We also
it. I
have
like
our
it.
hoodies and all of this stuff.
This one's probably my favorite right now.
Yeah, that's one of them.
Nice weather here. It's not too cold anymore, so that's a nice little in between.
So this is one of our hoodies, and all of this stuff is embroidered, by the way, Britt, and anybody watching. All of this stuff is embroidered, so we have our logo there, and all of our hoods on our hoodie have Because.Teeth on the top there. So
That is
this is
so
just
cute.
a lavender color. I'll show you
Yes,
everything
perfect
before
color.
you pick.
Before she makes a selection, you got to browse the rack first.
You gotta browse the rack.
All right, what's next
my
here? So we got the
I love
same
that.
same design here, but in a nice pale pink color.
We call that baby pink.
Baby pink. There we go. What else we got up there, Greg? All right, going on another
So
version here.
cute.
Gray, what
So
you got any names for the gray? What do we got there?
I would call that Heather.
Heather Gray.
It's not really Heather, but we'll call it that.
Yeah, with our shirts we got creative with the dental term colors, but the gray
This
would
is
be a
so
tricky
cool.
one.
So this
Alright.
is the same one. It's just got a different color.
Got a nice blue on it.
Yeah, on the hood. That's
Blue
the only-
stitching
Oh, you
instead
could-
of the white.
You could call it suspicious area.
That's good.
These are some of the shirts.
Yep. New shirts we got.
Wow.
What did we go? What was our yellow we put? I forgot it. We said it on the website.
X you date.
Oh, I think Exudate. Is that what we went with?
Well, no, I don't think we would put that. Did we?
It probably came up and Greg probably shut it down. He's like, no, we're not doing
I
Exudate.
don't like Exudate. So we got the blue.
Bluish teal kind
Same
of
thing,
patch
so
on the arm.
Yeah, they're all the same like that. Got that.
I really like the black hoodie with the Because Teeth. Hey, what's that tie-dye thing down there? What is that? What's that going on?
She's looking at the tie
That's
dye.
still in the works, Britt. So these are blanks.
I'm like, that looks really cute.
All right. Once we come up with the tie dye, we'll make sure you get one
That's
of those. But
cute.
they're just blank right now. We're working on those, but I'm glad you like them.
The tie dye is soft.
It's one of those things. It's kind of hard for us because obviously, hygiene is a female-dominated, profession, and it's kind of hard to come up with some of this stuff, because we're two guys. So
Yeah.
So that's kind of our honest getting feedback on it too.
Yeah. Well, actually, okay, I like the baby pink. That's my favorite.
Baby pink.
This one.
Yeah.
Okay.
Yeah, I like the baby pink. That's cute. The hoodie.
All right. And
That's cute.
we will. Do you want the one with the white lettering on it, or you want the one with the blue lettering on it? It's like a
I
navy
want
blue.
The white.
Okay.
Yeah, I want the white.
All right, you will have that soon,
Yeah,
Britt.
that's
So
cute.
we will send that. We appreciate you coming on the episode.
Thank you so
Make sure you
much.
go. If you guys don't follow her already, I'm sure you guys probably follow her and know her on Instagram. So
I know when we were first thinking about this, it was funny because we talked about, you were like, we were like looking around at different people, and you were definitely one that came up. So
yeah,
I think that's why we were a little nervous at first, because it was like, hey, this is somebody
Yeah.
that we've
we look
seen
up
for
to,
a while
for
and
sure.
looked up to. Yeah. So
yeah, you're definitely a staple in the community community, and we looked up to you and listened to your podcast. So if you guys don't know, she has a podcast obviously too, and has an YouTube as well. So I will pop those up as well. And other than that, we appreciate you coming on, Britt, most importantly. Yeah. And I had fun. I hope you had some fun. And
yeah, thank you so much for having me. I'm excited for the episode to come out, and I'm excited to have you guys as new hygienists soon coming up here. So yeah, congrats on everything, your new job coming up, and you guys are going to crush it.
Yeah, we still got to take boards. So yeah, fingers crossed.
You got it.
All right, so we'll wrap up this episode, and yeah, see you on the next episode.
All right.
Bye.
Why do we do it?
Because teeth.